So, hello and namaste to all my friends. And so today we are going to talk about one of my absolute favorite repertories. It's a repertory, and I know that you must be feeling that I speak about this in the similar tone to almost all the repertories, but really, some of these repertories have have been so important and so special in my life, in my clinical practice, and it has given me a paradigm shift in understanding and in solving cases that I really couldn't think could have been solved just by conventional Kentian technique. So we are going to talk today about one of my favorite repertories, a repertory that I do believe is a must. Is a must. Um, we are going to talk about Boger Boenninghausen's characteristics and repertory by Master Cyrus Maxwell Boger. And and of course, there is so much to talk about this repertory. So I'm going to divide this talk into two parts. Yeah. The first part of the lecture is today, right? Today is the first part. So I'm going to give you a broad overview of the lecture of the BBCR and show you how to treat kind of different cases with Boger Bonninghausen characteristics repertory. Of course, my colleagues have also taken a lecture about Boger Bonninghausen, especially Dr. Srinivasan. And the second lecture, which we'll have at some point, is where I will be sending about 5 to 8 cases to you, where you have to all solve the cases by BBCR. And I will just tell you the analysis in the lecture. So this will be another lecture. This I will tell you the date for it. Okay, so this is 2 lectures, and I will tell you when the second lecture is. But let's come back to talk about this repertory, Boger Bonninghausen's characteristics repertory. What a fascinating repertory this is. And the first time I ever thought about using this repertory was because of a great homeopath from India. His name was Dr. Bhanu Desai. So he was one of the homeopaths in India. And he has written a book which I believe is superior to any other book for Boger Bonninghausen repertory. It is called as How to Find Similimum with Boger Bonninghausen's repertory. This is a fantastic book. And I believe the only book where you'll find actually how to use this repertory. This is the book because of which I learned how to use this repertory. And I wanted to talk to you about Bhanu Desai, and the author who has written this book was a great person. He used to practice in the slums in Mumbai. He used to practice in a part of Mumbai called as Dharavi, which is known as one of the Asia's largest slum. And he used to practice homeopathy there. Imagine, it's a place where, you know, the most complicated infectious diseases, malaria, dengue, chikungunya, it happens. And so he would practice there, and his practice was based on per patient he would get exactly 10 minutes, and he would see about 40-50 patients, and most of them would be just with fever and dengue and malaria. So there is no question of asking about dreams to these patients or asking about their basic nature as a child. So the idea was to prescribe symptomatically and to treat pathologically and to give results quite soon. You have to be very sharp in such cases. And Bhanu Desai used to treat so many cases like that. And he especially used to use, in majority of cases, the Boger Bonninghausen's repertory. And this is what inspired me to take up Boger Bonninghausen characteristics repertory. The first place where I started my clinic in Mumbai also was a place close to a place called as Shivaji Park in Mumbai. Um, I started my clinic in a garage actually, was a broken place, and I got it at a very cheap price. So I opened, and during the rains there was to be many cases of waterlogging around. So many acute cases, viral cases, malaria cases, dengue cases, and in the initial days I was not very confident of treating such cases with homeopathy because I hadn't treated such kind of cases in my life. And that is when I got accustomed to Boger Bonninghausen characteristics repertory. And with the help of this repertory, I became much more confident treating all these kind of cases of malaria, dengue, chikungunya, pathological cases with almost no symptoms. And even during COVID, and some of you were in touch with me, or you were attending my sessions, or we were doing many cases together, we treated a lot of COVID pneumonias, many complications of COVID. One of the main reasons we were very confident was using Boger Bonninghausen's characteristics repertory because it's a method by which you can treat very deep pathological cases with very few symptoms quite quickly and with solidity. So that is the reason. This is the broad outline of what I wanted to talk to you today about. And one of the first experiences of my life where I thought in direction of Boger Bonninghausen was a case of a 5-year-old child of a subacute sclerosing panencephalitis. The father was my kind of patient also, and he one day came and told me that my son is now admitted in the hospital and he has he had measles, and the measles went to the brain, and then he had fever, and then he was comatose. He was in total coma, and there isn't any treatment for this, and they have put him in a hospital and he's not responding. And can you do something? And I tried to ask him few questions, and the only thing I realized is what he had a lot of cough and cold, and he had measles. He was not responding, and there was a total lack of reaction to allopathic medications. Now I was confused. How do I analyze this case? I really didn't know. And that is when I thought of using Boger Bonninghausen characteristics repertory. And I wanted to just very quickly show you how I started to think about. So the first thing he said was that everything started after measles. So I went, and this is the Boger Bonninghausen characteristics repertory. This is the software. I want to tell you, and I will teach you about the structure and the philosophy a little later. And this is the software, but of course, the software is not perfect. And my initial phase was actually using the book. I used to actually keep a book with me, and it's there in the clinic. So I would use the book, and that's how I actually mastered Boger Bonninghausen's characteristics repertory. The first rubric I took was, you can see here, in that there is a chapter generalities or sensations in general, and in that there is a very beautiful rubric, measles after. You can see here, generalities, measles after. This was the first rubric I took. The second rubric I took was, I went into the sleep chapter. Have a look at this sleep chapter, and then I opened the rubric. You can see comatose. You can easily see that there is a pathological rubric, and there are very few remedies in those rubrics because they are all clinically relevant and very short kind of remedies. The same rubric in complete repertory, comatose and unconsciousness, will give you more than 500 remedies, right? So this is a very solid, objectively pathological kind of repertory. The next rubric I took was that the fact that the child was not responding to anything at all. So reaction poor. That was my next rubric. This was the only thing that I knew for sure 100%, right? And you can now clearly see there are only four remedies here. At this moment, with a comatose child who's not responding at all, the remedy that started screaming at me was the remedy. You can see how beautifully, just by taking the main things, we came to carbo vegetabilis. Of course, my knowledge of materia medica also confirmed uh, carbo vegetabilis because we confirmed a few more symptoms. And you can see in the hospital, the child was admitted, not reacting to anything. You can see here. So we gave carbo vegetabilis. And I also checked Alan's keynotes. Those were the days I used to read a lot of Alan's keynote. And there was a very nice symptom of Alan's keynotes here written. I'm going to read it for you. A person who has never fully recovered from exhaustive illness of previous illness, especially diseases dating from measles. So this gave me a confirmed kind of pathological idea. And we started with carbo vegetabilis 10m, 6 hourly, locally rubbing on the soles, on the wrist, and on the forehead. This was the idea. And there was a slight response initially. The Glasgow Coma Scale started improving. He started opening his eyes. And then again, it stopped responding. So we went to carbo vegetabilis 50m twice a day. And the child who was not responding at all, you can see here. I'm going to just try to show you. After a few days, the child was discharged from the hospital. He was able to come out of it. And you can see the child here. He was brought from the hospital, then home, and then here to see me. And you can see the father, and he was so happy. And you can see the child is already restless. You can see he's trying to go out of the door. I used to have a video, but I can't really find it. And this is the child here, you can see, much later, in a good health. He did very well, and they are so grateful to homeopathy. So fascinating, no? To see such kind of response. This we were able to do with carbo vegetabilis, and especially our knowledge of Boger Boenninghausen characteristics repertory.